Good morning everyone. Okay, we're back into the PSV again today, which is the patient support vehicle. So this is half an hour before my shift starts. I always like to be in the vehicle doing your checks, making sure the vehicle is roadworthy and patient worthy before we actually start shift. It's a really good idea to make sure you're here probably half an hour, 20 minutes before shift time, because there might be some things in the bags that haven't been replaced. The fuel maybe not full to the top. You know, there might be some things in here which you think, actually I should have checked beforehand, because if we go to a job and the bags aren't, you know, replaced what they needed, or someone's forgotten something, then we're stuck, and the patient then is compromised. So try and get to your job, try and get to your work between 20 and 30 minutes before time. It's not paid, but it's your own time, but it helps in the long run to get you an idea of what to look for quickly for what you need for the day. Okay, so on the PSV, as I mentioned beforehand, because it's a patient support vehicle, it still can do frontline work. We still get called out to Cat 1s, which is the priority, you know, 8-minute get there, it's a heart attack, that sort of things. Majority of the times I've been on PSV, it's for a Cat 2, 3 or 4. So all blue lights on 1, 2 and 3. 4 is a transfer which is requiring just normal road conditions, you know, no blue lights at all. One thing I have noticed, that when we do our patient information to put in the details, we have what's called like a TOF pad, okay, which is this thing here. Okay, this is our little TOF pad, and it's called the EPCR in ambulance terms. And we used to have lots of paper, big reams of paper to put all the details down of the patient. But this machine, this device, allows us to do so much more. We put all the details in, we can check patients' details from the past, we can check the doctor's prescriptions and things like that, and we can take photographs with it as well. The way you use that is just basically by touch the screen with a little stylus. A lot of people have nowadays figured out that it's actually easier and quicker to use a wireless keypad, which you can get on Amazon for about $9.99. I've got a Technic one or something, and what you need to do is put a little tiny dongle in the side. If I show you, where is it? In the side of the TOF pad, in here, and that then connects the keypad to the the TOF pad, and it makes writing the story or writing the history of what's going on that day a lot quicker. You still need the stylus to do the touching the boxes and things like that, but personally for me it's much easier, especially for spellings and things like that. Okay, so when you come on board the vehicle, of course you need to check your green bag, which is this one here. Okay, that's our grab bag, which has cannulas. It's got the Sharps box on there. It's got your BP, your blood checker, you know, for the sugars. It's got your SATS machine. It's got everything we need for every single job we have. We also need to check our red bag, and in there you have what the paramedic would need for trauma, for intubation and that side of things as well. Everything in this vehicle we have to make sure we check. Okay, so it's not just the green bag we check the red bag. We also check to make sure that we have the Entonox, we have oxygen. We also have what's called a suction device to make sure that works, which is, if I can show you here, this is our suction device. Okay, this airflow allows us to help the patient get up. It's like a mattress thing. We have to make sure there's plenty of water on board, and extras, which are all on the top parts of the cabin here, plus of course all of our bedding and sheets for the change of every patient. Doesn't matter the patient's sitting on the chair, doesn't matter the patient is lying on the seat, on the stretcher. Every time a patient has left the vehicle, we must clean up after them. Okay, it's just to make sure that no infection, you know, is transferable. No matter the cleanest person in the world, we clean everything. I even clean my steering wheel. Okay, not to say that people are dirty, but it's just hygiene. Okay, so that's what I'm going to be doing this morning, waiting for my crew member to come along. And yeah, so far it's been really good. Working the PSV means that you're not working directly with a paramedic, so you're not picking up the skills of the paramedic. However, the PSV does allow you to work alongside another emergency care assistant, ECA, and learn slowly about the tough pad and things like that, and in your own time. When you're on front line with a paramedic, generally it's a lot quicker and you have to pick up things a lot quicker. So if you're not sure what line to go on, if you just started the service, and someone offers you a PSV job for, I don't know, a couple of months or something like that, or even when you're relief, jump on it, because it's a really good learning curve. You learn so quickly on this vehicle, and always remember you do have backup as well if you need it for the paramedics. So you always got your control right by your side on your radio saying, help, I do need some help, I need a paramedic here, I need a double crew here, I need some advice. So never think you're on your own, because you never are. This company in SWAST, we work as a team, and we are you know, we don't let other people flounder on their own if they need the help. Okay, so that's me from now. I'm going to get on and do my checks, and I shall see you soon. One thing I have to say is my apologies for not having enough videos coming up lately. As you probably know, that I have to have it all okayed by SWAST first of all, and it takes some time for them to go through my videos before I'm allowed to upload them. So again, thanks for SWAST to allow me to upload these videos, and see you guys later. Take care, be safe, drive careful, bye bye.